I'm Miles Hassell, and you are listening to Walk, Don't Run to the Doctor. It's our regular podcast that we do, and today we're going to be talking about cancer, survivorship, and prevention. But it's primarily going to be focused on the patient with cancer and improving outcomes, or what we call cancer survivorship. However, it is of note that everything that you do for a cancer patient to help them keep them alive in the lifestyle spectrum of interventions are also the same things that you use to help prevent cancer. So don't see this as an either or. See this as the basics for helping somebody both prevent cancer and also prevent recurrence of cancer and improve outcomes from cancer. And so when we say outcomes from cancer, we mean outcomes related to having a cancer and being treated in conventional ways. So this is by no means suggesting that people use lifestyle instead of conventional therapies such as immunotherapy, surgery, radiation, chemotherapy. That would be really dumb. What this is an add-on, what we consider a critical add-on, a critical component of every cancer patient's choices. The new diagnosis of cancer is obviously frightening people. It certainly should catch your attention. And so one of the things that people do, of course, is they go and say, hey, what therapy should I have? What surgery? What chemotherapy? What radiation? What immunotherapies are appropriate that will reduce my chance of dying, reduce my chance of recurrence, kill this cancer? And so all the conventional therapies are very important. But what we're going to be arguing throughout this presentation is that your lifestyle choices, diet, physical activity, weight management, other factors, are as important as any other aspect of cancer therapy in terms of your outcomes. So we're going to be touching on a few high points today. For those of you in the Portland region, we'll be having a town hall on this next week. And then for those of you who are seeing this in the archived form, within a couple of weeks, probably by the first week of November 2024, we'll have our greatmed.org website with our full cancer survivorship management program. So that will be a much more extensive version. This is just going to be touching on the high points. And that, once again, I'm hoping that you will realize that these steps, these lifestyle steps, are as important as any other choices you make in cancer therapy. And so we're going to be talking about those things that improve survival and reduce risk of recurrence, improve energy and quality of life during treatment and after treatment, and reduce side effects from conventional therapy. So one of the things that's, I think, overlooked is that patients who take better care of themselves through treatment actually have fewer side effects from that treatment. They tolerate the treatment better. When you tolerate the treatment better, you're more likely to be able to have a full course of therapy for radiation, for example. So these benefits of lifestyle therapy are very, very interleaved with conventional therapy. We are conventional medical physicians. We are not alternative in a sense. But we believe that lifestyle therapy is really important. So we're going to be talking today about dietary choices, waste management, physical activity, and we're going to be touching on controversies, especially alcohol, but that'll be the detailed version of those controversies will be as part of our town hall next week and our comprehensive cancer survivorship guide. Whenever you're assessing claims from our group or anybody else, have a few key points that you take into account. And one of those is total mortality outcomes. So if anybody says to you, you should do this or you should do that, ask them if the data suggests a reduction in total mortality. We consider this as the most important single finding that's so often overlooked, because if you have a case where you can improve one aspect of health and worsen another health aspect of health so that the net result is zero, we don't think that that's much of a benefit. So everything that we talk about will be things that are associated with less total mortality, less cancer recurrence, better side effects, better quality of life. So when we look at cancers, if we look at patients with cancer, actually let's do a pause for a second. Overall, I just needed a break. little clumsy, but getting into it. So if I just say pause, yeah. Okay. Okay, let's go. So when you're looking at the patient with cancer, more patients with cancer die of heart disease and stroke than die of their actual cancer. And this is really important finding to think about, because it means that we don't just focus in cancer survivorship, we just don't focus on the cancer and immunity and so on, which are all important. We also say, what else is this patient at risk for? And that is going to be our key. So not only as you're thinking about your treatment for your cancer, not only do you want to do things that prevent cancer death and cancer recurrence, you also want to look at things that reduce side effects from cancer therapies, that will reduce heart disease and diabetes, stroke, and so on. So let's start with diet. The dietary approaches that have been studied are extensive. They include traditional whole food diets, and for that we would include the Mediterranean diet, the DASH diet, the Chinese food pagoda, for example, all these different traditional diets, all of which we think are beneficial. The greatest degree of evidence is for the Mediterranean diet, but we suspect that all whole food diets work, and so we'll be talking about that. We won't be talking much about vegetarian and vegan diets or high-protein diets such as paleo diets and keto diets because of the lack of data supporting their use. But if we start with the Mediterranean diet, the Mediterranean diet is an omnivorous diet, meaning all traditional foods are included. And that includes dairy, fish, meat. It emphasizes, however, vegetables, fruit, beans, legumes, grains, whole grains. Olive oil is the primary kitchen fat, and moderate alcohol is usually included. In a sense, if you want to look at it this way, it is the original plant-based diet, but it's not limited to plants, and that's where the word plant-based is we think is very, very troublesome, because our diet, the Mediterranean-style diets, are plant-based diets emphasizing fruits, vegetables, beans, and grains, but they also include dairy, meat, eggs, fish, poultry. So the reason we emphasize the Mediterranean diet is it's by far the best studied diet that shows a reduction in cancer, heart disease, stroke, diabetes, lower total mortality, better quality of life, and frankly, better mood. Even if you use it to treat people with depression and anxiety, you see better results. In contrast, highly restrictive diets, such as vegetarian and vegan diets, have just not shown great outcomes for cancer, especially in cancer survivorship. And plus, many of us don't particularly want to follow a vegetarian or vegan diet in terms of quality of life. So the vegetarian and vegan diets, we think, are really suffer from the lack of data, despite great enthusiasm for them, and lack of evidence for outcomes, including quality of life, which we think is really important. So let's go back to the whole food Mediterranean model. And so we emphasize whole food because although we're talking about the Mediterranean diet model, I repeat, this probably applies to all traditional whole food models. So whole intact grains, so avoiding white flour products, for example, avoiding highly processed products such as breakfast cereals, and sticking to traditional whole grains, wheat, rice, barley, rye, quinoa, whatever you want. Vegetables and fruit should be emphasized, and we would argue that you should have vegetables and fruit, vegetables or fruit with every meal and snack. Fish, meat, and poultry. The data we look at suggests that probably somewhere around a pound to a pound and a half of red meat per week is probably a reasonable limit. And that's measured, the pound to pound and a half is measured raw. You don't have to eat raw meat though. Cultured dairy, such as yogurt, kefir, and cheese. Milk actually has pretty patchy data for health benefit. We're not at all sure that milk, which is not really a traditional food, because in the absence of refrigeration, which didn't become popular until the 20th century, in the absence of refrigeration, milk is really not a practical food, whereas storage forms of milk, yogurt, kefir, and cheese, have always been a practical form of food in almost every society. Nuts, seeds, and legumes frequently, so we would say, hey, have nuts and seeds and legumes every day, and extra virgin olive oil is the main kitchen fat. Now, the problem with the extra virgin olive oil is that lots of traditional diets didn't have extra virgin olive oil. And we don't know how to assess that further, except to say, people who have more olive oil in their diet have lower cancer rates. We're going to look at a couple of actual studies, and the references will be in the show notes. Actual studies that look at actual outcomes in actual cancer patients. Pause. Tor is trying to be helpful. I won't go into detail for him. I'll just say. I've got to remember there's a pause.
You can just stop.
Yeah, that's what I mean. I just don't. I've got to get more relaxed about that. Found the phone. Thanks.
Oh, you do put an APB out when you couldn't find the phone I stole?
Well, I just said, hey, did you see the phone there? And she said no, and I said, don't worry about it, because then no. And then I just wasn't listening. And then I suspect she said something to Tor, who jumped onto the Find My Phone app, and
Awesome.
Was trying to be helpful, but
Cool.
but he wasn't looking for the right phone.
So when you're ready, we'll go back to
Okay.
looking at some actual papers.
Yeah. So, sorry, that's right.
Mhm.
So
Found it.
So now we're going to be looking at some actual papers for actual cancer patients with actual cancers. In other words, strongly encourage you to only use data from the real world. We aren't using models. We're not using hypotheses. We're using actual data from the real world. So this is the Shanghai Breast Cancer Survival Study from 2020. And it used a food frequency questionnaire to look at outcomes from about 3,500 breast cancer patients at about 5 years after their diagnosis. And it looked at total mortality, recurrence rates, metastatic rates and deaths, and also breast cancer specific mortality. And basically, the finding was that the higher the adherence to whole food recommendations using the Chinese whole food model was associated with substantially reduced mortality risk and breast cancer specific improvements and death among patients with breast cancer. Now, the pattern of food that they emphasized in this particular study was included fish, poultry, beans, grains, nuts, and legumes, eggs, vegetables, and dairy as the foods that had the strongest association with better survival. And I think you'd recognize that's a pretty omnivorous diet. This particular group didn't have high red meat consumption. How much benefit? We say there's a benefit. How much benefit? Well, we're talking 25 to 34% lower risk of dying from any cause, 36 to 40% less risk of breast cancer specific events, meaning recurrence or breast cancer death, for example. And pause. The benefits were substantial. 25 to 34% lower risk of dying from any cause, 36 to 40% lower risk of breast cancer specific problems, such as recurrence of breast cancer. And these dietary choices that were associated with less cancer and less early death emphasized whole foods. They did not eliminate any traditional whole food group, and they did emphasize minimizing added sugars. And we'll be talking a little bit more about this later on, but the whole processed food, highly sweetened foods issue remains prominent in all health outcome research. And so if you're going to take one thing away from this group of studies is get rid of refined carbohydrates and sweet foods in your diet to the best of your ability. Another study had looked at 3,500 women with invasive breast cancer. So these are women with, they didn't have the early forms of breast cancer such as DCIS. These were invasive breast cancer. And adherence to the whole food eating patterns in this group was also associated with somewhere between 21 and 27% lower risk of dying from any cause. This was called the Pathways Breast Cancer Survival Study. The foods in this study that were associated with better outcomes were the whole fruits and vegetables, whole grains, beans and legumes, fish, and nuts. So you can sort of see a bit of a pattern, whether it's from the Chinese model or from a Western model. A couple of the foods that really stood out in this study were whole grains and nuts. And they also saw that if they used something called a Mediterranean diet score, that was also associated with better survival. And when we see some of these patterns, of course, remember that patients who do better in one area do better in another. So sometimes whether or not eating more nuts prevents cancer is not necessarily the outcome, although we suspect it might be true. But it also reflects the fact that in these dietary patterns, things can be a marker of benefit without actually being causative of that benefit. So it's worth remembering that in terms of how you think of your overall diet model, that no one of these foods is magic. The food pattern does appear to be magic. And when we look at the kinds of numbers, 20, 30, 34% risk reduction for death of any cause, remember, these outcomes are superior to what we see with many of our traditional cancer therapies. So this is not something to be brushed to the side when you get around to it. This is something to face wholeheartedly as part of your cancer therapy, right along with surgery, chemotherapy, radiation, and immunotherapies. In the EPIC studies, so this looked at the particular one we're using here. The EPIC studies are a large European group of studies. And we're looking at a 2023 study segment that included 13,000 women with breast cancer. And they used a Mediterranean diet adherence score that had 16 points. So many of the Mediterranean diet studies look at the overall adherence to a Mediterranean-style diet that gives you a dose-related response. In other words, they can say, hey, this person was consistent with all 16 points that we're measuring here, or it was consistent with only 10 or 12 and so on, and able to, if you have a large enough population, you can start seeing a dose-response curve. If you have greater adherence, do the patients do better? These were followed for 8 years, so a pretty reasonable a period of time. And I digress for a second to remind you that a study only looks at very short-term outcomes is not very helpful to you. A study that looks at 2-year, 5-year, 8-year outcomes becomes really helpful. And so those who had a low adherence to the Mediterranean diet had about a 13% higher risk of all-cause mortality compared to those who had only medium adherence. So you didn't have to be perfect in this study to see a very, very substantial benefit in terms of risk of dying. In addition, if you looked at every 3 points of improved adherence on this scale, each 3 points was roughly associated with about an 8% reduced risk of overall mortality. And this was for premenopausal women, postmenopausal women, and had even greater degree of benefit in those who had metastatic breast cancer. So that tells you something about what this is doing for your immune system and your immune system's ability to recognize cancer and suppress it using the intrinsic God-given tools that your body has. So the point, and I hope I'm not overemphasizing this point, but the point to be emphasized over and over is that whole food choices for the cancer patient is really important. Is associated with anywhere from a 20 to 35% lower risk of dying of any cause, has been seen in hundreds of studies, and in many cases exceeds the benefit that we see with conventional cancer therapy. Extra virgin olive oil has a unique place in the literature in this regard, where we have dozens of studies that show that people who have more olive oil use have lower cancer rates and lower total mortality than people who have less olive oil use. So we would argue that extra virgin olive oil should be your primary kitchen fat. That's not to say you don't use butter sometimes. You might want to use coconut oil sometimes. But those would be secondary oils in my judgment rather than primary oils. Extra virgin olive oil should be your primary oil. In contrast, the other vegetable oils, canola, avocado, soy, peanut, and so on, those have some weak evidence for harm, and I'm not aware of any evidence for benefit in terms of health outcomes. And so we would argue against using any of the highly processed vegetable oils such as avocado, grapeseed, peanut oil, and so on, and stick to extra virgin olive oil.
Just watch your watch. You might want to take it off and pocket it, but it can trigger the mic.
Oh, okay, all right.
It really picks it up when it taps the table.
Should I take it off now, or
You can if you want.
I don't think most people will notice. They'll say, "Why did you take off the watch?" I'll just not tap it because now I've got a funny looking wrist. So I finished olive oil, didn't I?
Yep.
Ready to go?
Ready.
Now we're going to talk a little bit about alcohol, and this is something that kind of is worrisome to talk about because it's such an emotional subject, and for good reason. However, it's a subject that's kind of important, as you'll see, and we have to be honest about it. Now, some people have trouble with alcohol. They can't contain their use of alcohol, and they drink too much. We're not talking to you because, let me start again. Now we're going to move on to the subject of alcohol and the cancer survivor. This is a issue that's extremely emotional, difficult for people to talk about, but we need to be honest about it. And it's controversial because with different ways of analyzing this subject, you have diametrically opposed results, not even close. And so you get from major organizations, you get everything from no amount of alcohol improves health, which we think is absolute nonsense, to those suggesting that light to moderate drinking is associated with reduced risk for all-cause mortality, including for cancer patients. And that would be the side that we think is most strongly supported in literature. These differences in conclusions are driven by differences in methods of statistical analysis, especially dependent on whether you include total death rate, total mortality from a study as part of your conclusions. We primarily rely on population studies and meta-analysis for our conclusions because we don't have randomized controlled trials of any value in the alcohol space. For example, the best health outcomes in most population studies, did scratching my face, is that bothersome? Okay. For example, the best health outcomes in most population studies is in the group who are eating well, not overweight, physically active every day, not smoking, and have moderate alcohol consumption. And the Nurses' Health Study is one large study that is a good example of that, showing this vast range of outcomes that are improved in this pattern of behavior. Now, when you look at a pattern of behavior like this, of course, we don't know which components of that pattern are the most important. But we do know that in most studies, the pattern of behavior that includes good food, physical activity, not being overweight, not smoking, and drinking alcohol in small amounts appears to be associated with the best health outcomes. Now, let's pivot to alcohol in the cancer patient. In general, we've already touched on low to moderate alcohol is associated with lower rates of death, primarily associated with lower cardiovascular and diabetes risk. We also know from population studies that cancer deaths are consistently increased in people who drink a lot. And drinking a lot is more than probably 1 to 2 drinks in women, more than 3 or 4 drinks a day in men. Those are daily quantity intakes. But those are amounts of alcohol that are more than most people drink. And so the question is, are low to moderate amounts of alcohol, such as 1 drink a day for women, 1 to 2 drinks a day for men, are they associated with more risk or not? And in the cancer data for primary prevention of cancer, so looking at people who don't already have cancer and saying, hey, does the alcohol increase their consumption, the data are all over the place. That's extremely inconsistent associations between cancer risk and small amounts of alcohol intake. And many studies show benefit in terms of total mortality, as I already mentioned. So then we pivot to look at the issue of what do we find if we look at low to moderate alcohol intake in patients with cancer? And that data is consistently reassuring, with low to moderate alcohol intake appearing to be associated with lower total overall mortality, primarily driven by lower cardiovascular mortality, better quality of life, and without causing any cancer-related harm such as increase in cancer-related death or cancer recurrence. Pause. So, back. Our conclusion is that low to moderate consumption of alcohol, including for cancer patients, is consistent with good health outcomes. And the guidelines of maybe 7 drinks a week for women, up to 10 to 14 drinks a week for men, is probably pretty reasonable. And I would tend to stay to the lower end of that. And this applies to people who can control their alcohol consumption. This does not apply to people who simply don't have control. And the data we're drawing from is dozens of papers, so we're actually not going to include them in the show notes. They will be in the town hall presentation, and they will be in our final cancer survivorship guide. It's a huge area, and we suggest great caution in interpreting what anybody says unless they're citing total mortality and actual outcomes in actual patients, not modeling behavior. Now we're going to talk about physical activity in the patient with cancer. So we talked about how good dietary choices are associated with 20 to 35% lower risk of dying for the cancer patient. We've now going to be seeing similar results for the cancer patients with respect to physical activity. So overall, if you look at physical activity in the cancer patient, daily physical activity, you're looking at somewhere around a 20 to overall, if you're looking at physical activity, daily physical activity in the patient with cancer, you're looking at about a 20 to 40% lower risk of dying of any cause during this study period, reduced rates of recurrence, reduced side effects of cancer therapies, and including fatigue and cardiotoxicity from many of our chemotherapy agents. We see improved mental outlook. We see maintaining of fitness so that there's less debility following cancer therapies. And that's because probably not only is their immune system working better, but also they maintain more muscle mass. And muscle mass is a huge predictor of long-term health outcomes. So we recommend that patients find something they can do that involves their upper and lower body more than once a day, that gets them short of breath, and it can be very brief. Don't punish yourself. For example, if you have a program that involves, say, some jumping jacks or stairs or counter push-ups that take you 30 seconds to a minute, and you do that 3 times a day, it's going to have a huge benefit for you. Some papers on that are in our show notes. Conversely, sitting is a big problem. So, is that being heard?
It is. So let's put that on the chair or something. So back to on the other side, sitting is a big problem.
Yeah. This microphone doesn't need to be any lower, huh?
That is as low as it goes, and I'm thinking of getting a new tabletop stand.
Yeah.
Because it can be set on the ground so that it's lower and go up higher. But there's a shorter tabletop stand.
Yeah.
So I'm just exploring if it will fit with those microphones.
That's interesting, yeah. Huh, okay. So conversely, ready to go?
Ready.
Conversely, in opposition to physical activity, you have sitting. And the trouble is, you can be somebody who exercises vigorously for an hour a day and still sit for 8 or 10 hours a day. And so sitting is sometimes referred to as the new smoking. So even if you're maintaining physical activity, remember that sitting is associated with higher death rates, independent of your overall fitness. And so don't allow yourself to sit for more than about an hour. Get up, move around a little bit, maybe a couple of counter push-ups, maybe a jumping jack or 2, maybe just some walking in place. It doesn't really matter. Get up out of your chair and move around. Move as if your life depended on it. And I'd like to revisit a thought I mentioned earlier, and that is, remember that all of these lifestyle choices are not just associated with better survival, lower recurrence rates for your cancer, but also a reduction in side effects from conventional cancer treatments. You're more likely to be able to tolerate the cancer treatments if you're doing all these things. And that emphasizes another aspect that a lot of people overlook, and that is we don't promote lifestyle choices as an alternative to conventional medical therapy. It's part of conventional medical therapy, and it should be emphasized much more than it is now. And it will make conventional medical therapy much better tolerated. Now let's talk about your waistline. So patients who have excess abdominal fat, mass around their midsection, not only have a higher rate of getting cancer, most cancers, they also have reduced survival, higher risk of cancer recurrence, and less tolerance of conventional medical therapies. In other words, if you're significantly overweight, our ability to image your cancers, our ability to treat that cancer is actually limited by obesity. And so there's numerous reasons to get your waistline under control. And so we have those references in our show notes. Let me try that again. We have those references in our show notes, and we will have our obesity guide on greatmed.org, and also as part of the try again. We'll have the obesity guide as on greatmed.org, and also as part of our survivorship handout in early November. And we'll be talking about this more at our town hall as well. But if you need to get your waistline under control, be brutal with that person in the mirror and say, I can do this. I can do it without drugs. I can do it by myself. And I can do it because I'm going to use the Big 5 rule. And the Big 5 rule is have a fruit or a vegetable with every meal and snack. And even better, have the fruit or vegetable before you eat anything else at every meal and snack. In other words, you might have an apple before you have breakfast, a handful of celery or another apple or a banana before my lunch. If you're going to have a snack in the morning or afternoon, you have more carrots, more apples, more pears, something. How about before dinner? Have a handful of raw broccoli. I don't care what you choose before your dinner. And you're going to find that you're going to reduce your calories by a few hundred per day by doing that, and you won't even notice. So, fruit or vegetables is number one. Don't reduce your protein foods. Fish, poultry, meat, whatever your protein foods are, dairy. Don't reduce them. Do reduce your highly refined foods. Get rid of as much sweets as you can and as much foods made with flour. Foods made with flour are a real trap for people who are overweight. So that's breads, pastas, pastries, crackers. And that includes the whole grain versions. These are calorie-packed foods that don't shut down your appetite. Another group of foods to think about getting rid of in the same, this is item 3 in the Big 5. Get rid of the liquid calories. Think twice about soups. They're often loaded with excess carbohydrates. Milk, great way of getting a lot of calories your body probably doesn't really need. Fruit juices, disasters. The one juice that we do suggest our cancer patients consider having at home are the V8 and tomato juice, the vegetable juices. Because these foods are often really good for electrolyte replacement, and they don't have a lot of carbohydrates in them. The fourth item on the Big 5 is eat food made at home. If you eat out, if you're eating fast foods, if you're eating restaurant foods, it really doesn't matter. Eating out is the source of incredible numbers of hidden calories that you don't even know about. It's very, very difficult to lose weight successfully and still eat out. And finally, brief exercise, upper and lower body, 3 times a day for increasing your metabolic rate and improving your immunity. Exercise by itself is a lousy weight loss tool. It's a lousy waist loss tool. But exercise by itself maintains your metabolic rate, helps maintain weight loss, helps your immunity, helps your mental outlook, and is critical to your long-term health. So those are your Big 5. Fruit and vegetables. Don't reduce your protein intake. Do reduce your highly refined foods and your liquid calories and your sweets. Eat food that you make at home, and physical activity 3 times a day, even if it's very, very, very brief. Don't give yourself any excuses. 3 seconds, 30 seconds, a minute, 3 times a day. If you care enough about your health, you can do it. And of course, we mentioned we have our weight loss guide on our website, and we have our weight loss guide as part of our coming cancer survivorship handout. There's a bunch of other subjects that are of interest to the cancer patient. Nutritional supplements generally don't have really a role in cancer therapy or cancer survivorship. There's a few exceptions that we'll talk about in our handout guide, but don't look to nutritional supplements to make a big difference in your cancer. There are a few exceptions to that, not very many. Special foods. You can make a case for things like flaxseed and barley and broccoli sprouts, all of which have a case to be made. However, in general, it's the food pattern that we see. The whole food pattern that we see as being beneficial. And so we will be dealing with individual foods that have potential benefit in our guide, but that's not the thing to concentrate on. No, there's no miracle foods. There's no silver bullet in the food world. Heat therapy is really interesting. So saunas and hot baths almost certainly improve outcomes. And we'll also be talking about the more restrictive diets in more detail, why we don't promote highly restrictive diets such as vegetarian or vegan or what's sometimes referred to as plant-based. We do promote plant-based diets, of course, but our plant-based diets also include dairy and meat and fish and eggs. So thank you very, very much for listening. We hope this is kind of a helpful overview for the cancer patient. Look for our upcoming town hall and our upcoming survivorship guide. I'm Miles Hassell MD. I'm an internal medicine practice in Portland, Oregon. The website is greatmed.org. The book is Good Food, Great Medicine, which I wrote with my sister. And the podcast is Walk, Don't Run to the Doctor. Thank you.
Quick 10-second short. Again, the number one thing I'd ask our cancer patients to do, based on the processed food diet data, is to eat whole foods. Was that the number one thing you said they could do? Like, what's the one thing you would suggest for the cancer patient, hoping to improve their survival rate? Say you're a cancer. Say you just got a new diagnosis.
How about 2 things?
Yeah. Or you have a loved one with a new diagnosis.
So, maybe you have cancer, you're going through cancer therapy, or you recently completed cancer therapy, or maybe you have a loved one with cancer. If you were just going to boil everything that we talk about down to 2 things, it would be these 2 things. 1, eat a whole food diet, primarily made at home, and including all traditional whole foods. Avoid, as part of that, this is still item number 1, avoid sugars and highly processed foods, and probably for the most part, breads, pastries, pastas. 2, get some exercise, get it more than once a day. Find something that works for you regardless of your disability. So disability might be from radiation, surgery, chemotherapy. There's any number of reasons why exercise might be difficult for you. Find something that will work for you. We always can find somebody, and give us a phone call at our office if you need some ideas. But find something that will work for you briefly, 3 times a day, and it can be as brief as you want it to be. But make it 3 times a day and make it enough to be short of breath.
Clip number 2. Why are people arguing about alcohol? Why do some governing bodies say they shouldn't have any? But the data seems to say mild to moderate alcohol is beneficial. We're going to be diving into that. Look forward to our upcoming cancer guide.
Why are people arguing about alcohol? Why is there these diametrically opposed views? One group that says don't drink at all. The other group that says low to moderate drinking is actually good for you. The reason is how you assess the data and what kind of data you use. And so we're going to be going into that in great detail in our coming cancer survivorship guide.
On greatmed.org. We're going to be going into that in great detail.
We will be going into that in great detail on our coming survivorship guide on greatmed.org. Thank you.